DUPILUMAB, which is an interleukin 4/13 antagonist, has been recently FDA approved for usage in the patients of a vesiculobullous disorder, which is bullous pemphigoid. Hello dear students, myself Dr. Maddineni Srinivas. Welcome to Crack DrMSD. We are going to quickly see some important points related to DUPILUMAB, so watch this video till the end. I hope all of you know bullous pemphigoid is a vesiculobullous disorder which is going to present with tense blisters present or urticarial wheals, and if you do a biopsy we are going to see eosinophils present, and this is also associated with itching. I hope all these points you are well aware. Okay, so what is the significance of this? So DUPILUMAB is going to act on these important pathophysiological steps which are associated with bullous pemphigoid. As you can see here, eosinophils which are going to activate the T helper 2 cells by the means of interleukin 4 and 13, and this DUPILUMAB, this monoclonal antibody, is going to act on these interleukins and it is going to inhibit these. Thereby ultimately what will happen, there is going to be reduced antibodies against the bullous pemphigoid antigen 2 and bullous pemphigoid antigen 1, BPAG2 and BPAG1, which is going to reduce the blister formation and also symptoms in the patients of bullous pemphigoid. So this is the mechanism of action of the DUPILUMAB. I hope all of you have understood this. Very important, you can take a screenshot. My question for all of you, this DUPILUMAB is already FDA approved for one important dermatological condition. Do you know what is the answer for this? Put your answer in the comments. I will tell you the answer at the end of this small talk. Medication is used. It is used subcutaneously, okay, and the patients can develop arthralgia, blurred vision, and also it was observed that in the elderly patients, of course in the bullous pemphigoid the patients are going to be very elderly, it was observed that there is going to be increased chance of herpes viral infections and also keratitis. So these are the problems which can occur. And remember, this is going to be a steroid sparing therapy, so very useful in the elderly population, especially who might be having comorbidities like diabetes, hypertension, where steroids are the treatment we use in bullous pemphigoid, but we can use DUPILUMAB instead of the steroids because steroids can themselves produce hypertension and also diabetes. So what is the clinical relevance? This could be the new gold standard for managing the recalcitrant bullous pemphigoid, okay, which is very difficult to treat. So my question was, what was the other FDA approved indication which is dermatological of DUPILUMAB? So I will give you the answer. It is atopic dermatitis. Very important to remember. Apart from this, there are other indications as you can see here. So wherever there are eosinophils, this is going to have a very clear-cut role, DUPILUMAB. So add-on point for dermatology residents PGs. So there is going to be increased chances of the psoriasis to develop in the patients of atopic dermatitis who are treated with DUPILUMAB. What is the reason for that? So I hope all of you know T helper 17 is very important for psoriasis pathogenesis, and DUPILUMAB is going to reduce the T helper 2, thereby there will be increased T helper 17, that is activation of TH17, which is associated with increased chances or risk of psoriasis. So this is something very interesting. So I hope this video was helpful. If so, like and do subscribe for more